Dr. Nichelle Haynes.
I'm Dr. Kristen Lassiter.
And we're Medical Mamas. This is your place to get evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like around your period, pregnancy, postpartum, menopause, and infertility.
Today we're going to be doing like a really basic video. I can't believe we haven't done it yet. We're going to talk about what is postpartum depression.
Yeah, we're breaking down all the facts about it.
I think just defining postpartum is like, we define it as the period from, it could include delivery to the first year after delivery, or maybe extending that a little bit if breastfeeding is extended.
Yeah.
That time.
Yeah, and a lot of postpartum depression actually starts in the pregnancy. So somebody who has depression starting in pregnancy and that carries on to postpartum, like, is still defined as postpartum depression.
So what do we think about when we think about symptoms of postpartum depression?
Yeah, so the criteria for postpartum depression is basically diagnosing somebody with a major depressive episode. And so that includes like having changes in their sleep, having changes in their energy, their appetite, their
interest, motivation. But I think the core of it is having a depressed mood, feeling down, blue, sad consistently, or not enjoying things.
Yeah, not being able to really enjoy things and just kind of feeling flat. And with postpartum depression in particular, we also see that I think it's like 70% of women with postpartum depression have a significant anxiety component too. And of course, suicidal thoughts can be there, or just death wishes, like, oh, if I just didn't wake up tomorrow, like, that wouldn't be so bad. Those are all kind of the main symptoms.
Yeah, but you know it's hard. Like, if you're not experiencing postpartum depression, you know it's hard, but you're able to find those joyful moments with like a smile or a coo or just like the snuggles.
Yeah,
and that might be absent.
That bond with your baby too, like really feeling connected to your baby, that's hard to do if you're struggling with postpartum depression. That's a common symptom. And also just not being able to sleep when your baby's sleeping is a very common symptom. So your baby at night is asleep, you know, partner's asleep, and you're just laying awake thinking or not being able to fall asleep. And that's happening frequently. That's a pretty common issue.
Why? Why is it happening?
Yeah, so postpartum depression has been studied more in the literature in recent years, and so we have a little bit more of an understanding of kind of what's going on biologically. And it's probably not just one thing. So let's put that out there. A lot of times people want to be like, oh, it's hormone changes.
Nope.
But no, everybody experiences hormone changes postpartum, but not everybody experiences postpartum depression. And so it's a number of things. Like, some women's brains might be more susceptible to hormone changes, but we also see that women who suffer from postpartum depression are more likely to have had mental illness before their pregnancy. They're more likely to have had
sensitivities to hormone changes in the past.
Sensitivity to hormone changes.
The things that I ask for during those times are like, do you feel, even compared to your peers during puberty, that like you had a more intense response to your hormone changes than your peers, or like kind of that PMDD, PMS type flavor of things, like around ovulation or post-ovulation, right before your period, you like really feel much different.
We also see like women who don't have as good of social support postpartum are at increased risk, or if there's a lot of issues between the woman and her partner, that's also a higher risk of having postpartum depression. So it's not just one thing, right? And so biologically, there's kind of lots of different theories, like hormone changes, some inflammation changes, maybe having to do with like a dysregulated HPA axis, which is basically the stress part of your regulation. So lots of different theories, and in reality it's probably a lot of little things that kind of combine to make the perfect storm, which creates kind of this spectrum of postpartum depression too.
Right, they're mild, moderate, severe. It can like occur very differently for different people. I've actually had patients come to me and say, no, I'm not depressed because I'm like still functioning.
Mm-hmm.
And that's not the thing. It's like, how difficult is it for you to function?
Right.
Right? Like, yeah, you're, for the most part, people still get up and do the things, even if they're severely depressed. But it might be more related to like, how hard does that feel? How much joy are you getting out of doing the things that you used to like to do? It's not about if you're doing it or not.
No. Why is it important to treat?
Because you deserve to feel good. Like, that's the whole thing. But also, the evidence base is that someone who has postpartum depression is not the only one that has negative effects from that, right? That it can like disrupt family structure, it can disrupt bonding, it can have long-term effects on the mental health and physical health of the baby, the development of the child. That it's not just the person experiencing the symptoms, it's like how that plays out in their relationships and safety for the child and interaction and all of those things.
Yeah, we're very social creatures, as we've talked about before, and that social emotional interaction with our family, our children, our partner is super important for everyone's collective mental health and well-being. And so if one person, even if it's not mom, maybe it's dad, if one parent is suffering from depression or anxiety in that postpartum period, so especially when baby's brain is developing at this astronomical rapid speed, it's going to be most affected during that time, and we're going to see kind of the largest risks for a parent having mental illness and the impact that that has on a developing baby.
Mm-hmm. So it's really important to get treatment. Yeah. Okay, we have videos on how to reduce your risk. I think that would be a good one. And then also to differentiate baby blues from postpartum depression, because they're not the same thing. So if you're confused about that, we do have a video, I'll link it underneath. And then perinatal anxiety, there's a lot of overlap there, so that's another video to kind of check out. If some of this sounds like, oh, familiar, or you want more information, those would be good ones to check out.
Yeah.
Okay, thanks for being here. Please like, comment, subscribe. We'll see you soon.
Bye.